Physical Therapy First, a presentation for second party payers, given by Andrew Lambert, Kayla Love, Miriam Sanders, and Meredith Thomas. Opioids are often prescribed to treat pain. Patients receiving opioids are typically experiencing a moderate to severe amount of pain. Opioids have often been used to assist patients after surgical intervention or even those struggling with common diagnoses such as chronic pain, osteoarthritis, and back pain. But how often are opioids being prescribed? What are the ramifications? Over 191 million opioid prescriptions were dispensed from pharmacies to Americans in 2017. According to the CDC, 1 out of every 4 patients that are participating in an opioid therapy in a long term manner and are seen in a primary care clinic struggles with an addiction to opioids. In 2018, over 67,000 Americans died from a drug overdose. The worst part is that, according to the CDC, opioids propose a high risk to individuals and have not been shown in some cases to demonstrate evidence based long term effects. These statistics are terrifying. So, what can we do to stop this problem? Our answer is prevention. The use of physical therapy in a preventative manner could be the key to not only stopping a patient's pain, but also saving their life. A recent study showed participation in physical therapy, specifically in those struggling with low back pain, reduced the likelihood of a patient receiving opioids in follow up care. But what type of prevention should be used exactly? When should physical therapy be used? To answer these questions, we must first understand prevention. Prevention can be defined by the strategies in which healthcare providers attempt to stop disease processes from occurring. This approach can be further broken down into 4 categories. Starting from the bottom of the pyramid, we have primordial prevention, which is preventative efforts applied to the population regardless of susceptibility, or in the case of opioid use disorder, the general public. The idea here is to avoid the development of risk factors by modifying social and environmental conditions. Next, we move up a level to tertiary prevention, where the preventative measure is trying to alleviate the symptoms of the disease process already present in the individual. Above tertiary prevention is secondary prevention, which involves early treatment in the disease process in order to halt or slow its progression. This approach to prevention involves early screening for signs and symptoms in the susceptible populations. Finally, our pyramid is capped with primary prevention, which is when healthcare providers take steps to prevent the disease from ever occurring in the population. We believe primary prevention is the major stepping stone to mitigating the opioid crisis. To participate in primary prevention, our solution is wellness physical therapy. Consider your yearly or semi-annual visits to the eye doctor, the dentist, or even your physicals and checkups with your primary care provider. Wellness checks every 6 months with a physical therapist could provide an educational opportunity for patients. So, what does a wellness visit with your physical therapist look like? This could include posture assessments, gait analysis, and strength evaluations. All these examinations could provide the therapist and patient with more insight into their physical health while preventing future injuries or even chronic pain. Therapists may also test outcome measures to provide the patient with a quantitative number of their changes in recent months, risk assessments to provide a better picture of their general health, and even set goals or write exercise programs to help motivate the patient and improve their function. So, why should you care? PT First, when compared to PT Later or no PT at all, can decrease costs for second party payers. One significant example of this is low back pain. When individuals with low back pain saw a physical therapist first, their cost of health services was less than those who saw a physical therapist later or not at all. This included lower utilization of expensive medical services like a visit to the emergency department, imaging such as CT or MRI, surgeries, and referrals to a specialist physician. Additionally, when individuals with low back pain choose physical therapy first, they had a lower probability of receiving an opioid prescription. This expands treatment options and helps to prevent the effects of opioid use disorder. So, we ask you to consider choosing physical therapy first and invest in wellness visits for patients to prevent further opioid use disorder. For more information, please see the references listed here.